How do trauma specialists diagnose complex PTSD? Imagine trying to understand a puzzle that has many pieces, some of which are hidden or overlapping. That's what diagnosing complex post-traumatic stress disorder involves for trauma specialists. They start by gathering a detailed history of the person's trauma experiences, especially focusing on prolonged or repeated trauma like ongoing childhood abuse, captivity, or domestic violence. This history helps them see if the trauma was sustained over time, which is key for a complex diagnosis. Next, they conduct thorough clinical interviews, asking about symptoms and using standardized tools like the International Trauma Questionnaire. This questionnaire helps identify symptoms of both post-traumatic stress disorder and the broader set of symptoms seen in complex cases. To meet the criteria for complex PTSD, the person must first show the core symptoms of post-traumatic stress disorder, which include re-experiencing the trauma through flashbacks or nightmares, avoiding reminders of the trauma, and feeling overly alert or hypervigilant. But complex PTSD goes beyond these core symptoms. It also involves disturbances in self-organization, which means difficulties managing emotions like intense anger or persistent sadness, trouble maintaining close relationships, and feelings of worthlessness or shame. These additional symptoms are grouped into 3 categories: emotional dysregulation, interpersonal difficulties, and negative self-concept. The diagnosis requires that these symptoms cause significant problems in daily life, affecting personal, social, or work-related functioning. Trauma specialists use validated diagnostic tools, such as the clinician-administered PTSD scale for the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, and the International Trauma Questionnaire, to measure how often and how severely symptoms occur. These assessments help differentiate complex PTSD from other mental health conditions like borderline personality disorder or depression, which can sometimes look similar but have different underlying causes. Because complex PTSD is a relatively new diagnosis, clinicians also relying on current guidelines and their clinical judgment to make sure they are accurately identifying the condition. They consider the person's trauma history, symptom profile, and how these symptoms impact their life. This comprehensive approach ensures that the diagnosis is precise and that the treatment plan can be tailored to address all aspects of the person's experience. In summary, diagnosing complex PTSD involves a careful review of trauma history, assessment of core PTSD symptoms, evaluation of disturbances in emotional regulation, self-view, and relationships, and the use of standardized tools to measure symptoms. It's a detailed process that helps trauma specialists understand the full scope of a person's trauma response, guiding them toward effective, personalized treatment options. Always remember, if you or someone you know is experiencing these symptoms, consulting a qualified mental health professional is essential for proper diagnosis and support.